CBS 2 investigator Pam Zeckman keeps digging into how Medicare fell for a scam and threw away a fortune.
More than $1 billion spent on medical braces for seniors who don't need them. So what's Medicare doing to stop the scammers? 2 investigator Pam Zeckman is on their case.
Our tale of a $1 billion fraud begins with the arrival of a box.
Let me see what this precious box has in it.
Stuff that I never ordered.
Nothing precious. The boxes contain unneeded medical braces for legs, ankles, arms, and backs.
So they sent you all of this.
Yes, but you see,
Do you need these?
I don't need these at all.
And neither does Paul Hack, who received 5 braces, which Medicare paid $2,500 for, and that he doesn't have a clue how to wear.
There's no way I'm going to get this in.
Records show Dr. Kenneth Pelahak prescribed all 5 of Paul's braces.
Do you know that doctor?
Never heard of them.
Never talked to him on the phone?
Never talked to any doctor.
Dr. Pelahak?
Yes.
Hi, I'm Pam Zeckman from Channel 2. We're doing a story about braces.
We caught up to the doctor outside his southwest suburban home.
You're the doctor that prescribed braces for a man we interviewed who didn't need them.
Dr. Pelahak did not answer my questions despite repeated calls. These types of braces have been arriving at the homes of Medicare recipients unwanted for years.
Some of these individuals are fraudsters.
A massive Medicare fraud scheme involving medical braces began unraveling earlier this month. 24 people and 130 medical equipment companies were named in federal criminal complaints in 6 different states. The feds say the schemers have bilked taxpayers out of $1.2 billion so far. Before getting their boxes of braces, Paul, Roseanne, and Nancy all received calls like this one.
This is an urgent message for all patients on Medicare regarding your eligibility for top-of-the-line braces to alleviate your pain and increase mobility. This is your final notice. If you do not act soon, Medicare will label you ineligible for coverage.
The feds say offshore call centers contact Medicare patients and get personal info from many of them. A doctor then signs a prescription for a brace, sometimes after a brief phone consultation. A medical equipment company fulfills the order and bills Medicare, sending a kickback to the original conspirators.
I feel like it's Christmas, getting a package and open it, and I see all this.
We first exposed this scam last fall when we talked to Mabel and Donald. Together, they received 15 braces, which cost Medicare more than $7,000. For months, we asked Medicare how much money the companies that sold these braces collected in total. We finally got our answer. The 5 companies that sent the 15 unwanted braces to Mabel and Donald received $7.9 million from Medicare over 21 months for 11,000 braces. None of those companies were charged in the recent brace bust. Lamont Pugh, regional director for the Inspector General's office, worked with Medicare on the recent fraud case.
None of the companies or individuals that were named in our reports so far were named in these indictments. Is this investigation over, or will you be looking at them?
This is a fraud scheme that has been uncovered, that we're well aware of, and that we're taking action to hold people accountable. And I believe that that will continue into the future.
Despite Medicare's investigation and all these indictments, for now, neither Medicare or the IG can say what steps are being taken to prevent this kind of fraud in the future. For example,
if you get multiple orders for braces for the same person, something's wrong, don't pay it?
Right. I agree with you. It's not that I don't agree with you, it's the system and how the system works.
Scam victims say the system needs fixing.
I don't have too much confidence in how Medicare works.
While the federal investigation continues, we'll be asking the billion-dollar question: what procedural changes will Medicare make to fix the system that allowed this to happen? We know these scam phone calls continue even after the recent indictments because I and other staff members have received them.
For tips on what to do if you think you've been a victim of this scheme, see our website, cbschicago.com. Brad and Erica.
So those phone calls, it makes it sound like they're losing all coverage, not that they're just opting out of getting these braces.
It does. It's very intimidating and threatening. If you get a phone call like that, what you ought to do is just hang up. Medicare is not going to call you and make challenges like that.
Yeah.
They are way, way off.
Okay. Thank you, Pam.